Anesthesiology Department HTAA.
Welcome to Anesthesiology and Intensive Care Department, Hospital Tengku Ampuan Afzan.
Intensive Care Unit.
The patients that come to intensive care are the sickest in the hospital. 21 beds, 21 lives, hanging in the balance. The hospital is near capacity 365 days a year, and the demand for intensive care beds is constant. The beds on the unit are the most expensive in the hospital, with the care and treatment they provide costing up to 3,000 ringgit Malaysia a day. Managing the flow of patients in and out of the unit is the daily challenge for the staff. Despite such pressure, a good teamwork and support system among staff ensues a conducive working environment, which in turn maintains their professional well-being.
Anesthetic Clinic.
Sometimes, a patient who needs surgery could have a number of complicated issues going on. Anesthetic clinic is important to ensure the patient is in optimal condition for surgery, for their safety. Anesthetist provides information about what to do on the day of surgery, and answers any questions that patients may have.
Operating Theater.
The department runs more than 10 operating theaters every day, both emergency and elective. With highly trained staff, high standard equipment, ensuring the best care for patients undergoing surgery. In anesthesia, even a narrow margin of error is sufficient to bring about catastrophic consequences. Therefore, vigilance is paramount. Patient is closely monitored during each second, on every breath. Even during regional anesthesia, such as spinal anesthesia, all possibilities are anticipated and are prepared for beforehand, for patient safety.
Acute Pain Service.
While most people are familiar with comforting voices of anesthetist during surgery, their roles extend beyond the operating room. They are also involved in pain management, both acute and chronic pain. The Acute Pain Service is working towards realizing the goal of HTAA, to become a pain-free hospital. Expecting mothers are given the option to experience comfortable delivery by means of labor epidural, a delicate procedure performed by experienced doctors.
Respiratory Hemodynamic Unit.
The team behind the scene often goes unnoticed. The Respiratory Hemodynamic Unit, a unit which consists of intensive care assistant medical officers and medical health assistants, plays vital roles in maintaining equipments, including ventilators, invasive hemodynamic monitoring devices and bronchoscope. Their participation in procedures, such as bronchoscopy, awake fiber optic intubation, and percutaneous tracheostomy, enhances patient safety. Even transport of critically ill patient is arduous without their involvement. 2020 COVID-19 pandemic. HTAA is one of the COVID hospital in the country. The anesthesiology department has mobilized COVID teams for both ICU and operating theater in timely manner. Even in such challenging time, the department managed to put occupational well-being and patient safety as top priority.
National Anesthesia Day 2020. Occupational well-being and patient safety.